I think we all have a sense of the impact of cancer, but I think when you look at the statistics, they really are stark. It's the second leading cause of death in the U.S. after heart disease. Actually, when we look at the data for 2012, it'll probably be the leading cause. As soon as that data is in, the cost is staggering, over $200 billion a year. For all cancers combined. We know that we can impact this, and in fact, the objectives that we're going to focus on today have objectives related to breast cancer and colorectal cancer. Emphasize that early diagnosis and screening can reduce mortality. I think the starkest figure for me, the strongest one, is that 2 in 5 of us will have a cancer diagnosis during our lifetime, and about 1 in 5 of us will actually die from cancer. So at times we think of cancer as a rare disease, and sometimes epidemiologically it is, but in fact it's not. It's something that affects all of us. On the next slide is a summary of the cancer deaths. Now, everyone can download the slides, or some of you have them ahead of time. Let me just point out that actually 4 causes of 4 cancers make up over 50% of cancer deaths for both men and women. And that's lung cancer, the lymphomas, colorectal cancer, and pancreatic cancer. And to that, if we add another couple of cancers, for males and females, we get up to over 70% when we add breast cancer to the mix, ovarian cancer, prostate cancer, and also in males, liver cancer is also particularly high. On the next slide, we turn to genomics. And we know that genetics can play a role. This is a new topic area for 2020. It can play a role in 9 of the 10 leading causes of death. These are outlined on the slide. Here we're focusing on cancer in particular. And for those who are at increased risk for hereditary breast and ovarian cancer and colorectal cancer, genetic tests can enable early detection and reduced mortality. The next slide just summarizes what we're going to focus on today. Again, it's breast cancer and colorectal cancer, and then a single objective of the 2 in genomics having to do with breast and ovarian cancer. So let's go to the data, as they say. On slide number 7 is colorectal cancer deaths. We've actually made, over the last decade, considerable progress here, falling from about almost a rate of about 21 per 100,000 down to about 16 per 100,000, which, relatively speaking, is a decline of about 24%. So that's quite positive. This slide is broken out by race and ethnicity, and what I call your attention to, I think the most salient feature on this, in addition to the decline, is the fact that the black rate is 43% higher than the white rate. Now, it turns out, but just because of the numbers here, that the way it works out, that the total is the same as the white rate, approximately the same. So when we graph it, one is essentially on top of the other. And that just turns out has to do with the rates, the size of the populations, and so forth. The target is based on, this is true for all of these, the target is based on what the rate was for the total in 2007, and the target is 10% less than that. Okay? I am really loath to say, probably not my role as the data person, but I really am loath to say that the races and ethnicity that lie below the target have actually met the target. In fact, what we'd like to see is progress over the decade. We're very early in the decade, obviously, but progress over the decade on all of these. Okay? And of course, combining them all together to meet that target figure. The next slide is breast cancer deaths. It looks very, very similar. Here again, the most 2 salient features are that there has been a decline, not as much in the breast cancer rate as there was in the colon cancer rate, but the disparity between the white rate and the black rate is again over 40%, about 41% in this case. The next slide takes the breast cancer data and graphs it according to some modified health service areas. And in large part, this reflects the prior slide. It reflects where people of particular races tend to live. But it's not all that. There are other clues and cues in here that are very important to investigate. And we just show this slide not because it's a specific objective, but because it says there are many different ways to look at the data. There is an interesting point on this, and I won't go into it, but if you go to the very top of North Dakota, it turns out that there is a very high rate. We don't know whether that rate is due to small numbers, okay? A small denominator, so to speak, population, where each case can make a significant difference. And frankly, if these rates were not 5-year rates and 3-year rates, it wouldn't show up. But again, it gives clues as to where we might go. That's actually just to the northeast of Minot. I think it's called Pierre, North Dakota. But I bring it up because you really do need, when you look at something like this, to investigate and understand the nature of the data. Now turning to incidence on the next slide. It's a slide showing the new cases of colorectal cancer, the objective for that. With the target, you can see somewhat below the 2009 rate, really 10% below the 2007 rate. Significant progress here in reducing the number of new cases of colorectal cancer, of invasive colorectal cancer. In fact, this is a decline of over the decade of about 25%. The disparity, though, particularly the main, or the one that I would focus on, disparity between the black rate and the white rate persists here. But also we see a significant disparity here between the male rate for males and females. Turning in the next slide to late-stage female breast cancer, we see that there's been a decline, over the decade, a much lower decline in the number of new cases. This was a decline of 4% between 1999 and 2009, the two bars on the left, and again the disparity persists, with the black rate well above the target set on the overall total rate, the white rate very close to that target.